Hi, Dr. Hussain. Thank you very much for joining me for this YouTube video. Is it okay if we do a quick YouTube video?
Yeah, that'd be great.
Dr. Hussain, we're very happy to have him today. He's from the Cleveland Clinic. He's the director of the Cerebrovascular Center at the Cleveland Clinic and also vice chair of operations of the Neurological Institute, as well as professor of neurology at the Cleveland Clinic. He's agreed to give us a short talk about different signs and symptoms that people might worry about in having a stroke. And is it really a stroke or not? Is that a good topic to talk about?
Yeah, thanks for having me. And I think it's always really important to talk about signs and symptoms of stroke. Unfortunately, we do know that in the general population, there's very little knowledge about stroke. Only actually about 30% of people can even name one symptom of a stroke. So hopefully I'll be able to take you through this and then give you some education so that you can correctly identify the symptoms of a stroke, because it's actually one thing it's a very, very treatable disease. And so knowing the signs and symptoms and getting to medical attention right away can save you in terms of life and death, save you from disability. So there are some good acronyms we actually use to help remember those signs and symptoms of stroke. And the one we utilize from the Cleveland Clinic is something, and used in many other centers as well, is called BFAST. So the acronym starting from the top: B standing for balance, any trouble with the balance or walking; E standing for eyes, troubles with your vision; and then FAST, the F stands for face, droopiness on one side of the face or the other; A standing for arm, so weakness of the arm, and you can apply that to the leg as well; and then S standing for speech, difficulty with getting your words out, speaking, getting your words out, or understanding language. And then the T is in there to remind us that the time is so important here. It's time to call 911 or whatever your emergency response system is and get to medical attention right away. Again, it's really important for that time element, because we estimate we lose somewhere around 2 million brain cells a minute in the situation of an acute stroke. So it's really a situation where every second and every minute counts. So if you recognize any of those symptoms from BFAST in yourself or in someone that you're around, important to call an ambulance, get them to get you to a hospital right away so you can get those potential treatments that you might need for stroke.
And in terms of time, you mentioned time and the treatments. There are a couple of new things out there. Can you talk briefly about maybe thrombolysis, thrombectomy? Are those the treatments you're thinking of?
Yeah, in the acute stroke setting, we have the two mainstays of treatment, as you mentioned, with either thrombolysis or what are clot-busting medications. There's a few different types that are out there, and they're basically there within 4.5 hours after the start of a stroke. We can give medicines through the intravenous that go and can dissolve clots in the blood vessels, and are very, very effective at doing that and can improve a person's outcome. Of course, they're very, very potent clot busters, so these are things that the medical professionals have to evaluate a patient, make sure they're eligible for that treatment, but they're very, very useful in the treatment of an acute stroke. And then for very severe strokes where we have large blood vessels that are blocked with a clot, in addition to potentially using that clot buster medicine, there are ways we can actually go through the blood vessels and remove clots out of the arteries. It's a procedure called a thrombectomy. And so we have different types of devices, catheters that can apply suction, kind of like a vacuum suction, to remove the clot out of the blood vessel, as well as stent retrievers, which are basically devices like essentially a stent, which is a wire mesh that we can use to entangle the clot and pull it out of the blood vessel. Also can be really effective in that situation to restoring that blood flow back to the brain, and that's being deprived of blood flow, and preventing injury to the brain, which can lead to death and disability.
I had one last question, if that's okay. Thank you again for the time and letting us use this for YouTube. So in terms of rehabilitation, let's say a person doesn't completely return to normal function after one of these techniques. What is an ideal situation? I know everybody's different, but in terms of having them in rehab, is it an hour a day, 3 hours a day? If you could do anything you want, not have to worry about insurance companies, I know you would probably use their particular recovery as your mainstay, but what's a general good time frame to consider rehab? A person who is, let's say, they can't use one side of their body and they can't speak or understand.
Yeah, rehabilitation after stroke is a very, very important topic. As good as we've gotten at treating patients at the front end to prevent their death, prevent death and disability, unfortunately, stroke is a disabling disease that can happen, and there are some patients who will have, as you said, weakness, speaking difficulties, other reasons, and that sometimes, if deficits are severe enough, having rehabilitation can be really, really important to improving their recovery. We talk about a recovery mainly in the first 3 months after a stroke, but even to a year or more, there can be recovery that happens. And as you said, it's a little bit dependent upon the individual situations and what's going on medically. Once a person's medically able to get to rehabilitation, it can be very, very useful to get them to those therapies as soon as possible. And early on, we know that the earlier we can get those kind of rehabilitation therapies going, physical therapy, occupational therapy, speech therapy, and other types of therapy, this is when the brain is recovering from the stroke, and you can use that recovery period to really enhance that recovery when we're doing those therapies. So really, when the person's medically stable and they can participate in the rehabilitation, I think it's a great, great thing to offer, and really as soon as possible after the stroke has occurred.
Well, thank you very much, Dr. Hussain, and we'll use this for YouTube video, and I'm sure that viewers will find this very informative, and especially from such a learned, educated gentleman. It's been a pleasure meeting you today.
My pleasure. Thanks for the opportunity.
Okay, bye-bye.
Bye.